As a new nurse, you have to understand central lines. They're not just a big IV in the heart. To understand central lines is to reduce infection for your patient. Hey, I'm Nurse Key and welcome back to a New Nurse Bootcamp where we take this thing out of being a new nurse. Okay, so let's get into central lines. Central lines are a powerful tool if inserted and maintained correctly. So central line is a intravenous catheter that's inserted into a large central vein, and then the tip of it sits near the heart and it delivers medication into the circulation. So the main places of a central line to be inserted would be the IJ, which is like we have an external, we have an internal IJ, which would be at the neck. It's easy for it to kind of be occluded because a person would bend and it may bother the patient there. Subclavian right here at the in the chest, subclavian vein. Femoral is in your groin. And then a PICC line is a peripheral placed central line, and it's usually up at the upper arm. So with these, you actually are supposed to measure the arm width consistently. What's the baseline, and then like once a day at least to make sure you can't tell if it's, so you can tell if it's infiltrated. So central lines have different entry points, but it's all the same destination, which will be right at the heart. So, of course, we give medications through a central line, but we usually use central lines with medications that are kind of harsh for peripheral veins, such as potassium or vasopressors that can kind of erode the peripheral veins just because they're smaller. And if we need long-term access, we'll use a central line. And there are certain medicines that are only given central line, like vasopressors at a certain rate, which is for your blood pressure, TPN, sometimes, like I said, potassium over a long period of time, or rapid fluids, or if you do CVP, or if you need frequent labs. With central lines, usually you're going to have 3 lumens, but you can have 1 to 3. Each lumen opens up at a different point of the central line. So let's say this is actually like your IV catheter. It's like one lumen can start here, another one opens up here, another one opens here, and this is all inserted in the vein. So this allows you to have different medications that could possibly be incompatible, but they're not touching each other because they all open up into a different area on the catheter. So the main points for central line protection or precautions is basically 3 things. Look at the site, the lumens, and patency. So for the site, you're going to do your dressing change per facility policy, but generally it's every 7 days unless it's soiled. So when you look at the site, let's say it's the subclavians right here, is the dressing actually sealed around the skin? There's no openings, no moisture up underneath it. Look through the dressing, see is the brow patch on, is it not soiled, is it actually placed properly onto the skin? Make sure there's no drainage, the skin is well intact, it's not red or leaking, and yeah, that's it for the dressing. Now for the lumens, you are going to, and when you do the dressing change, it's a sterile procedure, of course. And then for the lumens, let's say you have 3, you're going to make sure like when you take, each hub should actually have a green cap on to keep it sterile and clean. And then when you take it off, you flush it. When you flush central lines, you do like a pulsation flush, pull back for blood return, and then flush it again just to make sure each site is actually patent. And scrub the hub for about 15 to 30 seconds with alcohol, and then let it fully air dry. It's best to label your lines when you have multiple medications running through each lumen, so you know what's running. You label the tubing, and you label it at the pump and label it at the patient. Sometimes just depending on what you're running. At shift change or check your lines. Run your lines from the pump to the patient. Make sure everything's connected and running at the proper rate. So it's a thing called CLABSIs. Although we try to prevent CLABSIs, they can happen just based on the area where the central line is placed, or just because the length of time that it was kept. But as nurses, it's best that we just know the practices to reduce these occurrences and try to pull these lines if they're no longer needed.